Welcome everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. A little bit of news before we go to Balzano, Italy. Go Local just published a story about a Rhode Island physician who in 2006 was arrested and lost his license for repeatedly doing inappropriate sexual behavior in front of children. He is now been appointed to be the head of medical services for the state hospital. Take a look at that article and take a peek at what the charges were, how he lost his license, and how his license was reinstated. That story just went live a few minutes ago. We'll have more on the coronavirus here in Rhode Island at 12:30 with Dr. Michael Fine. Let's go to Balzano, Italy with Rebecca Couto da Silva. Rebecca, thank you so much for joining us.
Thanks as always for having me.
So Rhode Island's having a record number of cases in Italy yesterday, 24,988 new cases, an all-time record, over 200 passed in the country. What is happening in Italy?
So we had this sort of chain of decrees, and this final one is, I believe, one of the first ones that we've ever seen with an expiration date. It's kind of always been from now until we say so. And this one they did in, excuse me, it was put into effect on October 20, I think it was signed October 24th and took effect the 26th. And it was big. Sorry, I do have to reference some notes here. So bars and restaurants closed at 6. In most of the country, I'll tell you, because my region actually did not receive the legally legal term, did not receive the order. So I'll tell you what our rules are too. But so bars and restaurants are closed at 6. Everything, museums, all gyms. At first they went after the sort of unsupervised contact sports, then all contact sports. Now I believe it's all indoor sports. I am not sure if something like tennis is still going, but there are very few things that you could do in terms of any kind of organized sport or machine, anything like that. Runners have been saved, was a headline. And let's see, we've got, cinema, spa, ski resorts were supposed to be closed. Museums, everything's just kind of shut down. They were debating closing things on Sunday and decided not to. So you've got this and then you actually have a hard curfew in a lot of places from 11 p.m. to 5 a.m. So if you want to be out from 11 to 5, you have to have a compelling reason that you had to have earlier in March to do anything at any time. Now, where I live, they said bars can stay open till 8, restaurants till 10. Ski resorts can stay open if they're already open. So I think 3 were saved. They actually closed down retail on Sunday and everything. I'm sorry, retail on the weekend. So if you want to go do some shopping at H&M or electronics store, sporting goods store, no, on the weekend. And then grocery stores are also closed on Sunday here where I live. So
those are big closures.
Yeah, here where I live, we've got this expanded ability to eat out and go to a bar and ski. But on the weekend, there's nothing. I mean, and that's really, really tough because a lot of that type of shopping happens on the weekend. I was surprised they didn't maybe close supermarkets Sundays and all other retail Saturdays or something. But I guess to me, it's funny to close something on a Sunday. It feels like it would push everybody to the store on Saturday. So that's
Saturdays
what's going on here.
Saturdays and Sundays in Europe, everything, all the shopping takes place on the weekends. Streets are full, stores are full, so I guess they're trying to address those gathering episodes. What's been the response by Italians to these very significant and strict orders?
There's been a bit of pushback, you could say. So I don't know if I mean, there were protests in most cities across the country, and a lot of them, I'm not sure, I should have read something in English, but they're calling them paper box bombs in the Italian press. So little, I guess, Molotov cocktail type devices are being thrown around, sometimes directed at law enforcement. So people are really, really not happy. I mean, you've taken away bars, restaurants, and sports. What are people going to do at night? And there's, go home and watch TV. And I think whereas you might be happy to do that 5 days a week, if you're not being forced to, once you're forced to, you're like, no, I want to go do my soccer and my pizza and this and that. So it's people are very upset, extremely big protests. And then even I believe the mayor of Venice did a more peaceful protest where they called it dinner at 5 because all the restaurants everywhere else are closing at 6 p.m. They had dinner at 5 in the morning.
Oh, I see. Well, Venice is a tough environment. I mean, every street is a tiny little alley. There is no open space anywhere in the city center. You have to go pretty far out on the island to get into any kind of open areas at all, and they're quite small. So I imagine that the virus just loves an environment like Venice.
Yeah, I mean, we've got very big reproduction rates right now, and there is some, we've really, really increased and doubled testing, and I think that that's going to be somewhat problematic. So here, the hospitals, it's problematic that what I'm going to explain next. The hospitals are, they provide a lot of general services that we would get in a clinic in the United States. So, for example, when Olympia gets her yearly eye exam, she will go to the hospital, to the health system, and do it. And so they are doing rapid testing at the hospitals now. And if you have COVID, you're being admitted, which is interesting because it's like, well, that's a pretty simple way to fill up the hospitals with people who don't need hospital care. And people are being admitted for 2 weeks who are completely asymptomatic because they tested positive. And I think that when you see things about the hospitals being overstressed, it's really important. I think it's something where hopefully they'll design some sort of a private transportation system where the person can have half an hour to get home or something if they're asymptomatic, because it's putting a very big strain on the public health system that, someone completely asymptomatic goes in for an eye exam and gets admitted for COVID.
Yeah, one of the interesting things about the Italian numbers, the number of cases versus the number of deaths, is what we're also seeing here in the United States. While it was a record number of days, nearly 25,000 yesterday or day before in the number of total cases, the number of deaths was unfortunate, but it was in the low 200s. The record number of deaths in Italy is over 900 in a single day. We're seeing the same thing, which is the hospitals are so much better now than in the springtime at treating folks and keeping them alive and making sure people live through this virus.
Yeah, and like one mistake that they made in Lombardy was they put COVID patients in empty nursing home beds right at the beginning. And
right, it spread like wildfire.
Amongst the most vulnerable. Right. And they also really went for it with ventilators. And now we're learning that it's much better if the technology is available, because it is much more expensive and much rarer technology to do a type of oxygen dialysis, right? That sort of artificial lung where you take out a lot of you reoxygenate the blood outside of the body, so that the lungs that are having so much trouble breathing are not then being sort of physically abused by a respirator. So there's been a lot of learning along the way. And, they're catching, it was, I think, September that someone asymptomatic was even allowed to be tested here. And, so until then, our testing and our death rate's going to be pretty high because you're just missing everybody else. And now you're catching everyone who said, well, I had an eye appointment in March and it got basically tabled until September, and now I'm going to go try to do it. So we'll see how that works. I think that there's some pushing where we want to pull. There's some sort of contradictory measures in place. I know everyone's trying to do the best job they can, and hopefully some people can step back and take a big picture look, because admitting everybody is not, I don't think, sustainable.
Last question, are businesses, offices, and schools still operational, or are there now new restrictions on those two environments?
Well, we're going to have a week off of school. This is not the US where every state or city gets to choose their vacation. This is Italy, where it's pretty standardized. So next week there's the Holy Day on November 2nd. And so that whatever week November 2nd falls on, that whole week of school is off, like a fall break. So fortunately, I think there will be a lot of ability to isolate kids next week. We here have actually had 2 cases, and we actually have different procedures now. It's not quite as tough as before. So now you can either do 15 days in home isolation and then go back, no testing required, or you can try to get out of home isolation through a negative test. So it's one of those things where I think something like 10 days ago, half of the kindergarten or a third of the kindergarten was sent home. And so they'll come out of their official isolation over this holiday. And then there's also a middle school class that is in isolation now. And what they're doing also is, I think they're using a rapid test, which is considered less accurate. So they're using a rapid test that gets you put in isolation. And then if the person who is positive to the rapid test gets a sort of a bona fide gold standard test and comes back negative, then that entire class can come out of isolation as soon as that negative test happens.
Rebecca, thank you so much.
Sorry, businesses, offices are generally closed.
Work from home.
Yeah, it's work from home. The other thing that the new decree did was they basically said that high schoolers should have 75% in at-home learning, so 25% in person, which is one of the measures that's been really controversial because kids need more than 25% sort of in person. And here where I live, they said, no, it'll be 50%. But fortunately, all the kids have a week off next week, and hopefully some things will get under control. There's the sort of idea, maybe Italy's going to go into lockdown too. Fortunately, last night, Conte came out and said, look, we have put these really strict measures in place, and we've got to wait 10 to 14 days to see if they work. Right. Because, to do another lockdown before we've actually really gone into these measures wouldn't make much sense. So I was really glad to hear that. Of course, that would change, I think, if we saw something like 50,000 new cases in a day. But hopefully we continue with that attitude, because the measures that we've taken are severe, and there's a week off school next week.
Rebecca Couto da Silva, thank you so much. Italy seems to be just a little bit ahead of the United States with the spikes. It used to be about a 4-week head start. Now it's about a 2-week head start, but cases are exploding here in the US as well. Please stay safe, and please wish Olympia a different but happy Halloween. And for everybody else, we'll be back at 12:30 with Dr. Michael Fine. And then at 1 o'clock, we're going to be talking to the folks at Hotel Providence on how they're working their way through this difficult time, and how they're working to promote staycations, as many Rhode Islanders really can't go far away, but do need that mental break of some kind of changed environment. So back to back, 12:30 and 1 o'clock. Stay tuned, stay safe, save a job, save a business, wear your mask. Thank you.